Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Cirrhosis. Introduction. The liver is an organ located in the upper right of the abdomen that plays an important role in keeping the body healthy. Cirrhosis is scarring of the liver. Scar tissue can form because of injury or long-term disease. Scar tissue cannot do what healthy liver tissue does. It cannot make proteins, help fight infections, clean the blood, help digest food, and store energy. This causes many serious health problems. This program explains what cirrhosis is and what causes it. It also covers diagnosis, treatment, and prevention of cirrhosis. The liver. Cirrhosis is scarring of the liver. The liver is an important organ of the body. It is located in the upper right part of the abdomen. The liver regulates the body's nutrition system. The food we eat is digested and broken down in the digestive tract. Different nutrients are absorbed and then taken through large blood vessels to the liver. The liver manages substances absorbed during digestion, such as fat, sugar, protein, and vitamins, so the rest of the body can use them. The liver gets rid of harmful substances called toxins before they have a chance to poison the body. The liver also makes bile. Bile is a liquid that helps the body absorb the food we eat. It is made out of a substance called bilirubin, a yellowish chemical. Bile is secreted directly into the first part of the intestines through the common bile duct. It can also be stored in the gallbladder before being secreted into the intestines. Bile gives stool a brownish-green color. The liver also makes special chemicals that cause the blood to clot when injuries happen. Cirrhosis. In people with cirrhosis, scar tissue replaces healthy liver tissue. This blocks the normal flow of blood through the liver. A liver with too much scar tissue cannot work properly, and you cannot live without a functioning liver. But early treatment can control symptoms and keep cirrhosis from getting worse. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms. You may have no symptoms in the early stages of cirrhosis. As cirrhosis gets worse, you may feel sick to your stomach, feel tired or weak, lose your appetite, lose weight, notice red spider-shaped blood vessels under your skin. Cirrhosis can lead to other serious problems that can cause symptoms. For example, you may bruise or bleed easily or have nosebleeds. Bloating or swelling may happen as fluid builds up in your legs or abdomen. Fluid buildup in your legs is called edema. Fluid buildup in your abdomen is called ascites. Medicines, including those you can buy over the counter such as vitamins and herbal supplements, may have a stronger effect in people with cirrhosis. Your liver does not break medicines down as quickly as a healthy liver would. Waste materials from food may build up in your blood or brain and cause confusion or difficulty thinking. Blood pressure may increase in the vein entering your liver, a condition called portal hypertension. Enlarged veins called varices may develop in your esophagus and stomach. Varices can bleed suddenly. This may cause you to throw up blood or pass blood in a bowel movement. Cirrhosis may cause your kidneys to stop working properly. You may also experience kidney failure. Symptoms of kidney failure include decrease in urine, high blood pressure, pain below the rib cage, pale skin, swelling throughout the body. Cirrhosis may cause your skin and the whites of your eyes to turn yellow. This condition is called jaundice. You may also develop severe itching all over your body. Cirrhosis can also cause gallstones. Gallstones are solid materials that form in the gallbladder or common bile duct. They are made of cholesterol or other substances found in the gallbladder. They can be as small as a grain of sand or as big as a golf ball. In the early stages, cirrhosis causes your liver to swell. Then, as more scar tissue replaces healthy tissue, your liver shrinks. A small number of people with cirrhosis also get liver cancer. Causes. Scar tissue may form in the liver because of injury or long-term disease. Cirrhosis has many possible causes, including heavy alcohol use, infections, some drugs, medicines, and harmful chemicals. Other causes include autoimmune hepatitis, chronic hepatitis B, C, or D, diseases that damage or destroy bile ducts, non-alcoholic fatty liver disease. Some inherited diseases can also cause cirrhosis, such as hemochromatosis, a disease that causes iron to collect in the liver. Wilson disease, a condition that causes copper to build up in the liver. Porphyria, a disorder that affects the skin, bone marrow, and liver. Diagnosis. Your healthcare provider will ask about your symptoms and medical history. He or she will also perform a physical exam. Certain tests are used to diagnose cirrhosis. Blood tests can be done to see whether your liver is working properly. Imaging tests, such as a CT scan or MRI, can show the size of your liver. These tests may also show swelling or shrinkage. A liver biopsy can also be done to diagnose cirrhosis. During this procedure, a healthcare provider uses a needle to take a small piece of liver tissue. The sample is then viewed with a microscope to look for scar tissue. Treatment. Once you have cirrhosis, nothing can make all the scar tissue go away. There is no cure for cirrhosis. However, treatment options are available to help stabilize the condition, control the symptoms, and minimize complications. Your healthcare provider will suggest treatment based on the cause of your cirrhosis and your symptoms. Being diagnosed early and carefully following a treatment plan can help many people with cirrhosis. If cirrhosis is caused by heavy alcohol use, the treatment is to completely stop drinking alcohol. If cirrhosis is caused by hepatitis C, then the hepatitis C virus is treated with medicine. In the late stages of cirrhosis, certain treatments may not be effective. In that case, your healthcare provider will work with you to prevent or manage the problems that cirrhosis can cause. In severe cases, cirrhosis may be treated with a liver transplant. During a liver transplant, the old, diseased liver is replaced with a healthy liver from a donor. Talk to your healthcare provider about your options and to set up a treatment plan. Prevention. Although cirrhosis cannot be cured, there are some ways to prevent it or stop it from getting worse. For example, you should see your healthcare provider for treatment of liver diseases. Many of the causes of cirrhosis are treatable. Early treatment may prevent cirrhosis. Do not drink any alcohol or drink in moderation. Alcohol can harm liver cells. Drinking large amounts of alcohol over many years is one of the major causes of cirrhosis. Try to keep your weight in the normal range. Being overweight can make several liver diseases worse. People with acute or chronic liver disease should avoid Tylenol, acetaminophen, and all products containing acetaminophen. If you need acetaminophen, talk to your doctor about a safe amount and learn which over-the-counter medications contain acetaminophen. Get vaccinations against hepatitis A, hepatitis B, and hepatitis D. There is currently no vaccine against the virus that causes hepatitis C. See your healthcare provider if you have hepatitis. Treatments for hepatitis B, C, and D are available. If you are on treatment, carefully follow your treatment directions. Good nutrition is important in the management of cirrhosis. A well-balanced diet of fruits, vegetables, grains, and milk can help liver cells function at their best. Proteins are also very important in a well-balanced diet, but you should avoid eating too much protein if you have cirrhosis. Too much protein can raise the amount of ammonia in the bloodstream, which may lead to mental impairment. Patients with cirrhosis should avoid eating uncooked shellfish. Shellfish include shrimp, prawn, lobster, crayfish, and crabs. Shellfish may carry organisms that can cause hepatitis or other diseases. You should also limit the amount of sodium in your diet to help prevent your body from retaining extra fluid. This will help you feel better and may prevent or delay complications such as fluid buildup in the abdomen. Limiting your sodium intake can also prevent fluid buildup in the lungs, which can cause breathing difficulties and lower extremity swelling. If you have autoimmune hepatitis, take your medicines and have regular checkups as recommended by your healthcare provider or a liver specialist.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Cirrhosis is scarring of the liver where scar tissue replaces healthy liver tissues. Some common causes of cirrhosis include heavy alcohol use, hepatitis infections, and non-alcoholic fatty liver disease. In the early stages of cirrhosis, you may have no symptoms. As the disease gets worse, cirrhosis can cause serious problems. Once you have cirrhosis, nothing can make all the scar tissue go away, but treatment can prevent cirrhosis from getting worse. Liver cirrhosis can be prevented by not drinking alcohol and maintaining a healthy body weight. If too much scar tissue forms and your liver fails, you will need a liver transplant. You can take steps to prevent cirrhosis or keep it from getting worse. Thank you for using Explain.